My name is Shane Costa. I'm the owner of Costa Family and Cosmetic Dentistry, and I've been a dentist for almost 14 years now. We give back to the community in many ways. We give back to schools, organizations, charities, whatever it may be, but I thought it'd be a good idea to be able to give someone a smile that they've always wanted and a smile that they always deserved. So we had about 40 people that entered the contest, whether it be nominations by themselves or a family member or a friend or someone from the community. We selected down to about 4 and ended up picking Kyle as the winner. But it was based on his story. He really gives back to the community with his girls. As a field hockey coach, and we really liked his story out of all of them. I knew it was a little bit more of a difficult case, but I thought we could really make a big difference in his life. You could just see it in his presence, how he hid his smile, and I just thought he would make the biggest difference changing his life.
I reached out to Kate and I said, "Hey Kate, I just nominated your dad. I really think that this is something that he struggles with but never would ask for it, and he puts all of us ahead of himself over and over again."
So Kyle's case was pretty difficult. When I selected it, I actually had to speak with Dr. Vigliante and Dr. Casagrande to make sure something that they'd be willing to help out and something that we could actually do, because his was a borderline surgical / orthodontic case, and they said they could do it without having to do major surgery. So once I verified with them, then I knew it was a go, because I knew it wasn't just something that I could carry out myself.
They basically called and said, "Craig, we really need you to help us with this. We have a patient of ours that we're going to take care of. They need orthodontics, they need some restorative dentistry, and we need a surgeon to help us do it." So I said, "Sure, I'd be happy to." We did a 3-dimensional x-ray on him to see if we could place the implant. There was adequate bone in the position where it needed to be placed, and we just set him up for surgery, and we did it.
In the old days, what they used to do, since they didn't have this technology, they would open patients up just to look and see if there was enough bone there to place an implant. If there wasn't, they would just close them up. So there was people getting unnecessary surgeries. So now it's all done 3-dimensionally, and it makes it more accurate and actually makes the procedure quicker.
It was pretty straightforward. I just needed to know where the implant needed to go. And Dr. Casagrande was able to use that implant as an anchor to move the arch around and line up the teeth where they're supposed to go, so that Dr. Costa could do what he needed to do. And then I saw the patient and follow up to make sure everything healed. But the healing time for the implant, for the bone to integrate into the implant before Dr. Casagrande could use it, was approximately 3 months.
Kyle's case is very complex in that it's a skeletal discrepancy. So when there's a skeletal discrepancy, you actually have to do things surgically. The upper jaw is behind the lower jaw right now, and it's creating an underbite. So we want all the upper teeth on the outside of the lower jaw. And that's the skeletal discrepancy that we were talking about, where it's not just the teeth, it's the actual bones that we have to figure out a way to line up, because you can't line up the teeth. You can't do anything cosmetically on Dr. Costa's end without fixing this part first. We were able to do this just with orthodontic treatment and a special new procedure called Propel. So the way that Propel works is it's accelerated orthodontics, but it's also orthodontics with a special procedure that we do here in the office called osteoperforations. So we actually go in the bone and make small little perforations in the office, very benign procedure, and we're able to treat cases that we wouldn't have been able to treat non-surgically. So Vigliante did the actual implant placement, and I actually used this implant to help pull all the lower teeth back. So when an implant's in, nothing can move. It's absolute anchorage, so you can pull teeth and push teeth wherever you want. The other part of it is he was missing multiple teeth. So he was missing a tooth right here called the lateral incisor. So you could see in this spot where the tooth was missing, over the course of each visit, we're adding space to create room for the tooth. We put a fake tooth on the wire there, and we're lining things up nicely.
As soon as his teeth started moving, his jaw changed and his whole face just changed. He went from having the round face that he used to have to just his jaw is way more prominent. And he was holding himself differently. He was starting to feel more confident in himself, even though he did have braces. He was just owning it. He owned it every step of the way.
The entire orthodontic treatment, which normally is around 1.5 to 2 years, only took 9 or 10 months because of the accelerated propel procedure that we did. And then at the end of the orthodontic treatment, braces come off and we turn Kyle over to Dr. Costa.
Dr. Casagrande and Vigliante started the case, and once it became my time to do the restorative, he was all set up and ready to go. We did a bunch of pre-planning, taking cast models, measurements, and so forth, and figuring out exactly how we wanted to place his new teeth. For the most part, his were his upper teeth that needed to be restored. He's missing a few teeth and also some broken down and misshapen teeth because of his bite that deteriorated over the years. So we decided that we were going to do veneers, crowns, and bridges on his upper teeth, pretty much restored his entire upper arch so we can give him that smile that he always wanted. Here, I'll hold it and you can move your lip
for
up.
you.
Here, I'll hold the mirror, you move your lip. That's a little. Looks pretty awesome, doesn't it? Oh my gosh.
Fluid smile.
Oh my god. So what do you think? Time to put him in?
Yeah.
Yeah?
Yeah.
Okay,
Awesome. I would cry if I could. I can't feel my face.
Lean your head back for me.
I had to do a double take because it was, was the man that I married all these years ago, but wow.
Okay, I'm Kyle Ritter-Push. I'm a lawyer. I do export compliance work. And then in my spare time, if you will, I coach field hockey. As much spare time as I can manage, much to the chagrin of my family, so it's sort of my passion. The teeth problem really started when I was in 7th grade and I hit in the mouth with a baseball. It knocked my top teeth up and back an inch and popped my soft palate. It happened in the middle of a baseball game. My mom took me to the oral surgeon. They wired my jaw shut. I'm convinced that from that process forward, my teeth that were already at an underbite went even further at an underbite. I mean, so much so that I could fit my knuckle between my teeth when I pulled back. The way they look certainly is phenomenal. I love that. It probably is the #1 factor for me is how it looks, and it wasn't believable to me that it was something that I was going to fix. It was just something I was going to have to deal with and just suck it up, as it were.
So it was interesting. It was a fascinating process for us to see him go through, and to see him now in social settings and the confidence. He was already successful and very confident. He's never ever lacked in that department.
I'm able to smile in not just a closed mouth way, right? Like I had mastered the toothless smile, my smile, which now I don't do really, I now I wear retainers every night, and I feel very confident that I'm going to have these teeth for, the foreseeable future.
Without Dr. Vigliante and Dr. Casagrande, it wouldn't be possible at all. Again, they provide services that I can't, and without them, it wouldn't have happened.
It's good to do good while you're doing good. So that's a quote I heard from someone, and it really holds true here in this situation.
Doing something like this for somebody else who wouldn't be able to do it normally, and making such a change in their family life, their professional life, and just their happiness in general is invaluable. So it's something that I wouldn't trade for anything in the world, and we're lucky enough in our office, and I'm lucky enough personally to be able to do something like this. That's part of why I do what I do.
Being able to change someone's smiles like that, really makes a big difference for me, because I'm able to use my skills to really benefit someone else's life. And I think, that takes him every day from someone who covers and hides a smile to someone, who is very confident now. He has a lot of energy and a lot of personality now. It just comes out even more so.
Perfect, guys, exactly the way it's supposed to look. It's impossible for this goalie to guard both sides. Right, Quinn?